Now, first to start off with, we should get a understanding of the directions in anatomy. So let's start off with anterior and posterior. Anterior means at the front of the body, and posterior means at the back of the body. So an example would be the toes are anterior to my heels, while posteriorly my heels are posterior to my toes. The next one we'll talk about is superior and inferior, with superior being nearer to my head, inferior being nearer to my feet. So an example would be my chest is superior to my abdomen, while my abdomen is inferior to my chest. Now let's talk about medial and lateral direction. So medial means nearer to the median plane, whereas lateral means further away from the median plane. An example would be my digits in my thumb. So my thumb would be in a lateral position, whereas my little pinky would be medial to my thumb. So I'll explain again. Thumb laterally to the pinky, pinky medial to the thumb. Now, let's move on to superficial, deep, and intermediate. So superficial being at the surface of the arm. Let's go with the arm for an example. So the muscle is superficial to the humerus, so the bone. Intermediate would be the bicep. So the biceps, just there. The bicep muscle is in between the superficial part and the deep part, which is the humerus, so superficial being the surface of the muscle. And the deep part would be the humerus, so the humerus is deep to the muscle. Now let's talk about palmar and dorsal. And palmar is the anterior side of your hand, whereas dorsal is the posterior side of your hand. And feet, it's a bit different in the anatomical terms. So with the dorsal part is the superior part of your feet, whereas your plantar, which is different, plantar is inferior part of your feet as well. And now let's finish off with proximal and distal. So proximal being more nearer to the trunk, and distal being further away from the trunk of the body. And that's all for the directions.